Good day, Miss. Today our group are going to talk about serial killer physicians poisoning patients in hospitals. Our group members are Chris, Junsong, Jialo, and I, Xin Li. In this article, a 45-year-old doctor was sentenced to live in prison for killing 3 patients in a Long Island hospital 7 years ago. Nevertheless, Doctor Michel Schwegel, who is now in jail for drug possession and fraud, is suspected of killing several patients and colleagues. He had poisoned co-workers, relatives, and his wife. He was charged with 3 counts of murder for the death at the Northport VA hospital just before he was set to be released from jail in early July 2000. The victim's body was examined and tested positive for poison, prompting the further indictment. Now I will pass to Jella to continue her part.
Thank you, Simi. Now, I'll be explaining about the ethical issue in this article. The ethical issue in this article is that the doctors ignore the ethical conduct of the medical profession. There are 3 ethical conduct of the medical profession that is related to this article, which consists of autonomy, non-maleficence, and justice. Autonomy means that the patient basically have the right to determine their own health care. In this article, Dr. Swango did not tell his patient what drugs did he use before inject into the patient's body. This little injection leads to the victim to death. Non-maleficence is to make sure the doctor knows to harm the patient. People except for themselves should not decide for them whether to live or die. However, Dr. Michel Joseph Swango took away their life without asking the patient's permission. Lastly, justice is to distribute the benefits and burdens of care across the society. As a result, he killed many innocent victims and was arrested in New York after his release. A doctor's mission is to cure, help, and save humans' life, which is to fight with Thanatos, who is the god of death, to take back the patient's right to live, not bringing humans to death. However, Dr. Michel Joseph Swango, a serial killer who was also actually a doctor, he killed his patient before they died. At the meantime, he also poisoned his colleagues, friends, and also wife. His wife made up her mind to suicide in order to extricate from being poisoned by shooting herself in the chest. His victim count may be as high as 60. He ignored the human's right to live and chose to end the patient's life without asking for any permission. He murdered at least 3 victims by lethal injection. On one occasion, Swango picked up a bucket of fried chicken from a fast food restaurant for his fellow doctors who are on duty at Ohio State University. All of them became ill, and some of them even vomited so hard that the blood vessels in their eyes broke. Last but not least, the consequences of the victim that they are being poisoned till die or taken away their life without asking their permission. If Dr. Michel Joseph Swango was not caught, more and more people's life will be taken away either through poison or lethal injection. Now, I'll pass the turn to Chris to talk about her part. Thank you.
Thanks, Jella. Next, I will use utilitarianism theory to further explain the morality of issues. Based on utilitarianism theory, utilitarianism is a philosophical theory concerned with the concept of presence of happiness and the absence of pain. In this article, Dr. Schwegel, as a psychopath, he likes to kill people as it could thrill him and it could remind him that he is still alive. Killings would bring more happiness to Dr. Schwegel rather than pain. However, according to utilitarianism theory, also states that the greatest good to the greatest number of people. This is also known as the consequence theories approach, since the outcomes determine the morality of the intervention. This approach could lead to harm to some individuals while the net outcome is the maximum benefit. Therefore, this act of killing by Dr. Schwegel is wrong based on utilitarianism theory, even he will get happiness through killing. This because it only benefits himself and will not bring any benefits to other greatest number of people. So it is violent to the utilitarianism theory. In this article mentioned that his victim could count maybe as high as 60. This means that at the same time when Dr. Schwegel gets his happiness, this act of killing by Dr. Schwegel will bring pain to 60 or more people than Dr. Schwegel's happiness oneself. By and large, killing is not be allowed with utilitarianism if it is only beneficial to oneself and will not bring any benefits to the largest number of people. On the other hand, if curing would bring benefits to the largest number of people, even though it will bring pain to some people, this act of curing can be accepted. Next, I will pass to Jun Song to continue with his part.
Thank you, Chris. Good day to Ms. Im. I'm Jun Song, and now I would like to talk about the second relevant to ethical theory study, which is deontology theory. Doctors who intentionally poison their patient should be prosecuted. Therefore, according to deontology theory, the doctor has a responsibility to act appropriately, regardless of the positive or negative effects that might result. Before using medicine on patient, the doctor should seek permission and consent from the victim family. This is an ethical philosophy that uses law to determine what is right and what is wrong. According to the ontological and legal basis on medical care in Spain, doctor's first ethical obligation is professional performance, which require proper scientific and practical planning rather than relying solely on humanitarian feelings on common sense. In order to prevent something unlawfully or professional integrity, this efficiency must include both professional honesty and private morality. Hence, that's why doctor, pharmacy, and their assistant must adhere to all applicable laws and statutes, including not only general civil and criminal law. When it is medically appropriate, the doctor has a responsibility to attend to his patient. He or she must freely and immediately, with no exception based on ideology, politics, religion, or morality. Doctors should not use drugs on patient without asking patient permission if the doctor does not follow the rules and it will detriment the patient life. Human empathy for one fellow man must describe the contraction relationship between the doctor and his patient. In this situation, the medical function is more of a moral duty to alleviate suffering and avoid death than just a social justice activity. That's all my part. And now I would like to invite Singi to talk about the opinion to this article.
Thank you, Jun Song. Now I will continue with our points of view. According to deontological theory, our group think that Swango who poisoned the patient unlawfully should be convicted. This is because deontology requires people to follow the rules and do their duty. A doctor's duty is to help and save a human life. But Swango not only poisoned patients but also innocent colleagues. Next, we think that Swango should be convicted because the act that Swango does is deprive other people of autonomy. According to the deontological theory, all individuals have their autonomy. We could not make any decisions for others. Therefore, even if the patient is suffering from illness, as a doctor, Swango should not decide to the life or death of the patients. Besides that, Swango has taken the actions to kill a patient. Killing is an unlawful action based on the country's rule. The deontological theory states that the rightness or wrongness of an action does not depend on the goodness or badness of the consequences. Since Swango had killed patients, Swango has done an unlawful action, thus he should be convicted. Based on utilitarianism focus on the equal value of everyone's happiness. In this case, Swango was only concerned about his own happiness by killing his patients and colleagues. Therefore, Swango should be convicted because he focused on maximizing his happiness but did not maximize other happiness. In conclusion, based on both utilitarianism and deontological theory, we think that Swango should be convicted. This is because what he did violate these two theories. Thank you.